Perhaps you know about or recall books about the visiting nurses who made home medical visits to isolated people back in the day. Well, they still exist along with other home visiting programs. I'm Stephanie Shelton, and I host the podcast Conversations on Health, How We Get There. And in episode 42, Dr. Karen Hacker, a former top CDC leader and now Emory University professor, says these programs are voluntary now because many people who need help are afraid to let strangers in their house.
I've been involved in the home visiting world for a long time, and I think that's always a question, right? And now, yes, we are moving into these strategies using telemedicine, and there are practices that are actually giving out a pad to people so that they can actually encourage that. And I think if you know that there is a new program right now for rural health that's going, states have been given a good chunk of change to start to really implement new strategies. I think many of them are using telehealth strategies and putting together the technology that's needed. But remember, you can't do telehealth if you don't have broadband and you don't have the internet, or you do not necessarily have the skill sets to be able to feel confident in using that kind of technology. Right. So I think we still have hurdles, but we are definitely, I think, moving in that direction.